Hello and welcome to the annual online training for medical marijuana consultants. My name is Allison and I will be presenting today on behalf of the Medical Marijuana Program at the Department of Health. Before we get started, I just want to connect with everybody watching and go over what we're doing here today. What is the purpose of spending 2 hours with us, and why has this become a requirement for medical marijuana consultants to renew your license? As you know, medical and recreational cannabis is not legal federally. As a result, the industry is still growing and constantly changing, and while change is a good thing, and this is an exciting time to be part of a growing industry, it can also lead to a lot of confusion and misinformation, particularly when it comes to the patient community who rely on us for accurate and consistent information. We also hope that this time will serve to connect you as a consultant with the Medical Marijuana Program as a resource for questions and suggestions. This training is for you. There are some subjects we have to cover, but the program would love to hear your feedback and any ideas you have for training improvement. First, we will do a quick review of the training agenda and the question and answer section that we will encounter throughout the training, and then we will jump right in. Today's presentation will be covering Washington State cannabis laws and rules, the rulemaking process, the medical marijuana program, the role of the certified consultant, DOH-compliant product, the patient experience, the authorization form, and the medical marijuana authorization database. At the end of each section, we will discuss common questions that may be asked of consultants specific to the content presented in that section. Please note that throughout the training, the terms marijuana and cannabis shall be used interchangeably. The scientific term for the plant is cannabis. The term marijuana has a questionable history, and there have been efforts to change the terminology from marijuana back to its scientific name, cannabis. So next up, Washington State cannabis laws and rules. How did we get here? First came medical. In 1998, Initiative 692 was approved by the voters. I-692 permitted patients with certain terminal or debilitating conditions to use medical marijuana. I-692 also granted affirmative defense to criminal prosecution for qualifying patients and their primary caregivers who possess no more than a 60-day supply. Then came recreational. In 2012, voters approved Initiative 502. I-502 allows adults age 21 and older to possess up to 1 ounce of marijuana obtained from a state-licensed and regulated marijuana store. All products pass through the state system, from private producers to the processors to the retailers. Hallmarks of the legal marijuana market include regulation and enforcement, seed-to-sale tracking, testing and labeling requirements, serving size limits, product restrictions, and taxation. 2015 was when the laws changed and integrated the medical market into the regulated recreational market. Under the Act, the Department of Health adopted rules for medical marijuana authorization database, training and certification of medical marijuana consultants, and product compliance. The primary goals of the law were to clarify what is meant by the medical use of marijuana, and to ensure patients have access to higher quality products to meet their medical needs. It allowed for state sales and use tax breaks for medical marijuana patients who are entered into the authorization database, and provided protection from arrest and prosecution for patients who are entered into the authorization database. In 2015, legislature passed the Cannabis Patient Protection Act, Senate Bill 5052. Senate Bill 5052 created regulation of the medical use of marijuana, specific requirements for patients under the age of 18, a single system of licensed production, processing, and retail sales, which had to be in place by July 1st, 2016, and consistent testing, labeling, and product standards. Under Senate Bill 5052, the Department of Health was tasked with creating a standard authorization form and with writing rules for 3 components of the law: product compliance, the authorization database, and the certified medical marijuana consultant. The department also established some continuing education for authorizing professions. Then in 2017, legislature passed Senate Bill 5131. Senate Bill 5131 allowed for authorized patients and designated providers that are entered into the medical marijuana database and hold a recognition card to purchase immature plants, clones, or seeds from a licensed producer or grower. Then the 2019 legislation was a busy one. There were numerous marijuana-related bills that passed. Today we're going to highlight two of those bills that were focused on addressing patient needs. House Bill 1094 was the Compassionate Care Renewal Bill. Previous regulations required an in-person physical examination for a patient who was renewing their medical marijuana authorization. Effective November 1st, 2019, if determined by a healthcare practitioner that their patient would experience severe emotional or physical hardship if required to have in-person physical examination to renew their medical marijuana authorization, that healthcare provider may renew the patient's authorization through the use of telemedicine. Furthermore, the practitioner may indicate on the authorization form if the patient is eligible for a compassionate care renewal of their registration in the database. Patients under compassionate care renewals are exempt from the photograph requirement when renewing their medical marijuana recognition card, allowing their designated provider to renew the card on the patient's behalf. Consultants should be aware that even if an authorization form is marked yes, the patient is eligible for a compassionate care renewal, it is optional for a patient to choose to take advantage of the compassionate care allowance. If the patient is there with you and they have a valid form and want to be registered, you may process the registration. You do not have to make them return to their healthcare practitioner for a new authorization. The other bill in 2019 was House Bill 1095, regarding minor patient access to medical marijuana in a school setting. Effective July 28, 2019, at the request of a parent, this act required a school district to develop and implement policies that would allow a designated provider, which for a minor child is a parent or a legal guardian, to administer a marijuana-infused product to their child for medical purposes while on school grounds. If you have any questions about this or need more information, contact the school district. So next on the agenda, we have the rulemaking process. The Revised Code of Washington, or RCWs, are statutes passed by the state legislature or by the vote of the people. Washington Administrative Codes, or WACs, are administrative regulations or rules adopted by state agencies and put in place to enforce the RCWs. RCWs can affect the entire population or just a group. WACs govern the state agency. An RCW that governs medical marijuana is 6951A, and a few of the WAC chapters that affect medical marijuana are chapters 246-70, 246-71, and 246-72. So when we talk about rulemaking, we are referring to updating and improving the Washington Administrative Code, or the WACs. In order to begin that process, the department must follow the procedural requirements set out in the Administrative Procedure Act and the Regulatory Fairness Act when conducting rulemaking. There are three major phases to rulemaking. First, we have the CR 101, which is the notification of intent to do rulemaking. Then we have the CR 102, which is the proposition of rule changes and the opportunity to provide formal input. And then last, we file the CR 103, which is the adoption of final rule. The CR 101 form is used to notify stakeholders of our intent to make a change. It will include a brief description of the subject, including the WAC chapters that may be affected, reasons why the rules on this subject may be needed and what they might accomplish, and finally, how interested parties can participate in the rulemaking activities. This is a great time to get your comments in and provide feedback for the rulemaking early in the process. Next, the proposition of rule changes and the opportunity to provide formal input. So the department provides stakeholders and interested parties the opportunity to submit formal comments on proposed rules before the department makes a final decision to adopt rules. When the department files a proposed rulemaking CR 102 form, it holds a scheduled public rulemaking hearing. An individual may provide comments either by attending the public hearing, submitting written comments using the agency's online rules comment site at Policy Review, or by mailing or faxing the comments to the department by the specified deadline. The CR 102 form provides a brief description of the rule, including the associated WAC chapters, a copy of the proposed rule text, the date, time, and location of the public hearing, the public comment deadline and the process for submitting those comments, and the process for obtaining a small business economic impact statement and the significant analysis if one was required. At the conclusion of the public comment period, the department must consider all formal comments received and must file the adopted rule language with the Office of the Code Reviser. This is done with the publication of the Rulemaking Order CR 103 form. Typically, stakeholders are required to comply with the adopted rule 31 days after the department files the CR 103 form and adopted rule language. In some exceptions, the effective date of the adopted rule may be specified as something other than 31 days after the form is filed. The CR 103 form provides a brief description of the rule and the associated WAC chapters, a copy of the final rule language, and the effective date of the rule. A concise explanatory statement that documents the formal comments that were received and the department's response are sent to stakeholders, anyone who submitted comments, and anybody who asks for it. If you have an idea for something that could improve the medical cannabis community, we would love to hear from you. As someone working on the front lines directly with the patient community, we appreciate your perspective in the medical cannabis industry, and we need your ideas to develop process improvements. Sign up for program notifications on our website at doh.wa.gov/medical marijuana to stay up to date on program rulemaking activities. We also email everyone on our mailing list a quarterly newsletter, which will usually contain any exciting rulemaking updates. So please send your ideas to medicalmarijuana@doh.wa.gov. The Medical Marijuana Program operates within the Department of Health in the Office of Health Professions. There are 2 positions dedicated to the program, along with many other wonderful individuals in the office who help keep the program running. As I mentioned earlier, my name is Allison Claiborne, and I am presenting the training on behalf of the Medical Marijuana Program. One position is the Medical Marijuana Program Manager. This role oversees operations and serves as a technical specialist for the Medical Marijuana Authorization Database. They act on behalf of the department for this program to develop and enforce regulations and rulemaking, set practice standards, review and monitor program budgets, as well as coordinate efforts with other cannabis regulating agencies in the state and around the country. We also have Reem Aldagistani, who is our amazing medical marijuana program assistant. She will be joining us throughout the training. Many of you may already know her, but I'll let her go ahead and introduce herself.
Hello, my name is Reem, and my job duties include providing technical assistance to medical store cannabis consultants, healthcare providers, and patients regarding the database, registering, and setting up accounts. I answer questions for consultants concerning their certification and requirements. I create and distribute billing statement to medically endorsed store. If you have any questions, concerns, or need assistance in any way, please don't hesitate to reach out to me. Now back to Allison.
So what exactly is the Medical Marijuana Program? The scope of our program includes administration of the Medical Marijuana Authorization Database, which includes providing training and end-user support, licensing and regulation of the Medical Marijuana Consultant certification, which includes approving the 20-hour training program, and setting standards for products that may be beneficial for medical use. and we will get into those categories and requirements a little bit later. There are a couple other programs within the Department of Health that touch on marijuana regulations. The Department of Health also licenses and regulates healthcare professionals who authorize medical cannabis, and we also have the Marijuana Prevention and Education Program. The Medical Marijuana Program collaborates with the Marijuana Prevention and Education Program and the regulating boards and commissions, providing programmatic updates and resources where needed. In the following slides, we will go into more detail about the 3 areas that fall within the Medical Marijuana Program scope. First, we have the database. The database is administered by the department, which means that we are responsible for making sure that it exists and it works, but we are legally required to contract with an external vendor who creates, operates, and maintains the database, which was done to protect patient information and privacy. Under the Cannabis Patient Protection Act, for adult patients age 18 and over, it is voluntary to enter the state medical marijuana database, but registration is required for patients under the age of 18 and their designated provider. The database is used by retail stores with medical endorsements to enter qualifying patients into the system, to create and issue recognition cards, and to verify a patient card when making a sale. Next on the agenda, we're going to talk about the role of the certified consultant. So the second area of oversight is the Certified Consultant Program. A certified consultant is required to complete a 20-hour training, maintain an active CPR card, and submit an application to be certified or granted a credential by the Department of Health to provide consultant services at a retail store that has a medical endorsement. Please note that a consultant may only provide their services at a medically endorsed retail cannabis store. This does not mean a consultant could not work at a non-medically endorsed store, but if they did, they could not provide consultant services to patients. A certified consultant may register a patient into the authorization database and create and issue a recognition card. They may assist a customer with the selection of marijuana products and other items sold at the retail outlet that may benefit the customer's medical condition. They may describe the risks and benefits of marijuana products and other items sold at the retail outlet. They may describe the risks and benefits of methods of administration of marijuana products sold at the retail outlet. Whenever practical, a certificate holder shall encourage methods of administration other than smoking. They may advise a customer about the safe handling and storage of marijuana products, including strategies to reduce access by minors. They may provide instruction and demonstration to a customer about proper use and application of marijuana products. And finally, the consultant can answer basic questions about Washington state marijuana laws. So this is an extremely important role to fill. When serving the patient community in the capacity of a consultant, keep in mind that you are working with a community very different to the recreational users you interact with far more often. The patient community often walks through your doors not because they want to, but because they are in so much pain or their quality of life is so poor that they are willing to try just about anything to get relief. They may be very unfamiliar with marijuana and feel uncomfortable or nervous. You can make all the difference in this experience for them. Smile and greet people when they walk in the door. Ask how you can help them, but be aware that they may not know what questions to ask. Shift gears from making a sale to how can you help this person. Make sure that you listen to what they came in looking for help with and make suggestions based on your knowledge. Also educate the person on the product that you are recommending. Help them to understand what's in it. Make sure they know how to use it. Advocate for methods other than smoking if possible, and mention that they should start low and slow and work their way up in dosing until they reach the level of relief that they are looking for. Trust is so important in these interactions, and if you gain the trust of a medical marijuana patient, you will probably find yourself with a customer for life. So any adult age 21 or older in the state of Washington can purchase any combination of the following from a licensed retail marijuana store: 1 ounce of usable marijuana, 16 ounces of marijuana-infused product in solid form, 72 ounces of marijuana-infused product in liquid form, or 7 grams of marijuana concentrate. Qualified patients and their designated providers who are entered into the medical marijuana database may legally purchase sales tax-free any combination of the following from a licensed marijuana store with a medical endorsement: 3 ounces of usable marijuana, 48 ounces of marijuana-infused product in solid form, 216 ounces of marijuana-infused product in liquid form, or 21 grams of marijuana concentrate. Qualified patients and their designated providers with a valid authorization form who choose not to be entered into the database may purchase only the amounts allowed for non-patients or recreational users. They may grow in their home 4 plants for personal medical use, and they may possess up to 6 ounces of usable marijuana produced from their plants. Patients and designated providers who are not entered into the database are limited to 4 plants and 6 ounces of usable marijuana, even if a higher number of plants is indicated on their authorization form. Patients and designated providers who are not entered into the database have only an affirmative defense to criminal prosecution. Recognition card holders may also grow in their home or as a member of a cooperative 6 plants for personal medical use and possess up to 8 ounces of usable marijuana produced from their plants. If the patient's healthcare practitioner determines that the patient requires more than the presumptive amount of plants, the healthcare practitioner may authorize up to 15 plants be grown for personal medical use, and that the patient may possess 16 ounces of usable marijuana produced from their plants. Please note that no more than 15 plants may be grown or located in any one housing unit, even if multiple qualifying patients or designated providers reside in that housing unit. The only exception will be for registered cooperatives defined under RCW 6951A 250. And this means if 2 people living in the same house are both authorized to grow 15 plants each, they may still only grow a maximum of 15 plants, not 30, because they live in the same household. And finally, please note that recreational home grows are currently illegal under Washington state law. Medical marijuana cooperatives allow up to 4 medical marijuana patients or their designated providers to join together to grow marijuana for the patient's personal use. Every member must be registered into the Medical Marijuana Authorization Database and have a medical marijuana recognition card. The total number of plants authorized for the participants may not exceed 60 plants. Cooperatives must register with the Washington State Liquor and Cannabis Board, and they must follow all regulations. Cooperative members may only be in a cooperative if they have a valid medical marijuana recognition card, if they form a 4-member cooperative, and they may only participate in a cooperative if they are at least 21 years of age. They may only grow up to the total number of plants authorized with a maximum of 60 plants. Patients may only belong to one cooperative at a time. Patients or their designated providers may grow plants in the cooperative and not anywhere else. Patients may use the marijuana and its product and not sell or give away marijuana or marijuana products to anyone who is not in the cooperative. A cooperative must be located at one of the members' homes. It is limited to 1 cooperative per tax parcel, and the garden must be enclosed by an 8-foot fence if outdoors, in a location where it cannot be easily seen or smelled. No cooperatives may be located in any of the following areas: within 1 mile of a marijuana retailer, within the smaller of either 1,000 feet of schools, playgrounds, recreation centers, daycare centers, or any facility restricted to people 21 years or older, or the area restricted by ordinances, or where prohibited by city, town, or county zoning laws. There are 4 main agencies involved in the medical marijuana market. I just went over the role the Department of Health plays. We also have the Liquor and Cannabis Board, They oversee the licensing and regulation of all marijuana production, processing, and sales. They also license the retail stores themselves. So a marijuana retail store, when applying for their license, can indicate on their paperwork that they would like to add the medical endorsement. This endorsement allows a marijuana retailer to sell marijuana for medical use to qualifying patients and their designated providers. To apply for the medical marijuana endorsement, you must have a recreational marijuana retailer license. To qualify for this endorsement, you must adhere to the following requirements: carry marijuana concentrates and infused products that have been identified as DOH-compliant by the Department of Health, enter qualifying patients and their designated providers into the medical marijuana authorization database administered by the Department of Health. They must issue medical marijuana patient recognition cards developed by the Department of Health. They must keep records of qualifying patients and designated providers' recognition cards and other records as required by the Department of Health and the Department of Revenue. And they must ensure that all employees are trained on medical marijuana, including the ability to identify authorizations and recognition cards. They must also enter information about medical sales in the traceability system. We also have the Department of Agriculture, and they manage pesticides, fertilizers, marijuana-infused edible processors, and industrial hemp. And finally, we have the Department of Revenue, and they manage taxes and record-keeping practices. Next, we will go over a few common questions from patients that may be asked of you as a medical marijuana consultant.
Can I be denied a place to live because I use medical cannabis?
While it is important to have an understanding of patient rules and laws, if a patient is asking any of these tough questions, share what you know, refer them to our website for additional information and legal counsel if they still have additional questions. You don't have to know all the answers, but you are often a first point of contact for cannabis patients, and being able to refer folks to accurate information is an important part of your role. As a tenant, you have no legal right to grow or smoke marijuana, even if you are medically authorized and have a recognition card. It is at the discretion of the landlord as to whether you receive that permission within the lease agreement. Under the Federal Fair Housing Act, housing providers are ordinarily obligated to provide reasonable accommodations for tenants with disabilities to ensure that they have the full use and enjoyment of their homes. However, the Federal Fair Housing Act reasonable accommodation provisions exclude from protection the current use of a controlled substance under federal law. Even though medical marijuana is legal under Washington law, it is not legal under federal law. Therefore, it is up to the landlords to establish whether they will allow the use of marijuana within the rental agreement. Having an authorization form or a recognition card does not give a renter the right to violate a rental agreement.
Can I grow my medicine in my home with children?
That is a great question. Regarding parental rights in growing medical cannabis in a home with children, a qualifying patient or designated provider may not have his or her parental rights or residential time with a child restricted solely due to his or her medical use of cannabis in compliance with the terms of Washington laws, absent written findings supported by evidence that such use has resulted in a long-term impairment that interferes with the performance of parenting functions as defined under RCW 2609-004. Next, checking back in with the agenda, we have DOH-compliant product. The third area of regulation that falls within the scope of the medical marijuana program is setting standards for products that may be beneficial for medical use. The Liquor and Cannabis Board regulates all marijuana production and sales, and the Department of Health rules extend those standards to address patient concerns for things such as heavy metals, pesticides, safe handling, etc. The Washington State Department of Agriculture helped us to determine which unapproved pesticides are most likely to be used in growing cannabis. We required testing for those prohibited pesticides and heavy metals on top of the Liquor and Cannabis Board requirements, and those products are considered to be DOH compliant. There are three categories of compliant product. We have general use, high-THC, and high-CBD. If the product meets the testing requirements, They may use one of the 3 labels on the packaging printed in either black or blue ink and no smaller than 1/2 an inch in diameter. A general use product is any marijuana product allowed by the Liquor and Cannabis Board that does not fall into one of the other 2 categories, including edibles, flowers, and concentrates. DOH-compliant general use products may be packaged in servings or applications that contain up to 10 milligrams of active THC. A unit must not contain more than 10 servings or applications and must not exceed 100 milligrams total of active THC. So any adult age 21 or older may purchase DOH-compliant general use products. Purchases are subject to sales tax. Qualifying patients age 18 and over or designated providers who are entered into the Medical Marijuana Authorization Database and hold a valid Medical Marijuana Recognition Card may purchase general use DOH-compliant product sales tax-free from retail stores with a medical endorsement. Finally, any licensed marijuana retail store may sell the general use compliant product. Next, we have the high-CBD products, and these are any marijuana product except for usable marijuana or other plant material intended for smoking, allowed by the Liquor and Cannabis Board, including edibles. When it comes to the packaged servings, concentrates may not contain more than 2% THC concentration and may have at least 25 times more CBD concentration by weight. Marijuana-infused edible products may contain no more than 2 milligrams of active THC and at least 5 times more CBD per serving by weight for solids or volume for liquids. Marijuana-infused topical products should contain at least 5 times more CBD concentration than THC concentration. Adults age 21 or older may purchase these products sales tax-free, including, of course, qualifying patients age 18 and over or their designated providers who are entered into the Medical Marijuana Authorization Database and hold a valid Medical Marijuana Recognition Card. Any licensed marijuana store may sell high-CBD DOH-compliant product. The final category are high-THC products, and these are marijuana products containing more than 10 milligrams but not more than 50 milligrams of active THC per serving or application. Only capsules, tablets, tinctures, transdermal patches, and suppositories qualify for high-THC classification. High-THC compliant products may be packaged in servings or applications containing up to 50 milligrams of active THC. A unit must not contain more than 10 servings or applications and must not exceed 500 milligrams total of active THC. Only qualifying patients age 18 and over or their designated providers who are entered into the Medical Marijuana Authorization Database and hold a valid Medical Marijuana Recognition Card may purchase high-THC DOH-compliant product. These are sales tax-free purchases. Additionally, only a licensed and medically endorsed marijuana retail store may sell the high-THC compliant product, so they are a little harder to find. Finally, let's talk about that logo. One of the challenges is getting patients and consultants familiar with what this logo means and where to find it. Chapter 246-70 refers to the WAC chapter that sets the compliant product standards, and that's why it's on the logo. If this sticker is on a product, it tells you that the product has been tested according to the requirements laid out in WAC 246-70 and therefore is considered to be a compliant product that may be beneficial for medical use. This is not the most intuitive label, so make sure to share this information with patients and be familiar with products on your shelves that are compliant products. So a common misconception is that cannabis can be organic. The term organic is a federal term coined through the USDA, and because cannabis is not approved or regulated through the USDA, the term may actually not be applied to cannabis. If someone comes in asking for an organic product, explain that the term can't technically be applied to cannabis, but that there are still products with higher testing standards in the DOH-compliant product categories. This is a great time to show your customer what a DOH-compliant logo looks like and what product you have available for purchase. You may be wondering why you've seen products labeled as organic, and these are companies and growers that may model their product testing after the federal organic model, but it's important to remember that they're not technically certified, so read the label carefully. This may be particularly important for patients. Current regulations do not require cannabis products to be tested for certain pesticides or heavy metals unless it is a Department of Health compliant product, per WAC 246-70. However, consumers may ask the retail store for third-party test results of any product being sold on their shelves. In order to comply with the quality assurance testing for the Department of Health compliant product, pesticide screening must be done by a certified third-party lab approved by the Washington State Liquor and Cannabis Board and must be completed at the time of harvest for all marijuana flowers, trim, leaves, or other plant matter. Pesticide screening and screening for pyrethrins and piperenol butoxide must also be completed for each batch of finished concentrates and extracts. There are thousands of unapproved pesticides out there. Testing for that many pesticides would be very costly, and most of the pesticides are unlikely to be used on marijuana. We don't want to make these tested products so expensive that people can't afford them. Pesticides on products are particularly concerning to the patient community because exposure can be hard for immunocompromised patients and patients with other medical conditions that can be exacerbated by the introduction of new and oftentimes harmful chemicals. When you think of cannabis, heavy metals are probably not the first thing to come to mind. So what are heavy metals doing in our cannabis products? Cannabis absorbs materials from the dirt it grows in, and that includes heavy metal elements such as arsenic and cadmium. Another well-known heavy metal is lead. Some metals can be good for us in small doses, such as iron and zinc, but the unhealthy heavy metals can be very harmful to humans, particularly to individuals with other medical conditions. Become familiar with the products in your store and find out if you carry DOH-compliant products so that you can share that information with your cannabis patients. The product packaging label must prominently display the following statement. This product is not approved by the FDA to treat, cure, or prevent any disease. Packaging for all products utilizing a Chapter 246-70 WAC-compliant logo must not use any words, symbols, or images commonly used in or by medical or pharmaceutical professions, including but not limited to depictions of a caduceus, staff of Asclepius, bowl of Hygieia, or the mortar and pestle. Logos may not use the word prescription or the letters RX. They may not state or imply any specific medical or therapeutic benefit. Statements may not claim to diagnose, mitigate, treat, cure, or prevent disease. And they may not mimic a brand of over-the-counter or legend drug. Recent guidance on structure and function claims from the Liquor and Cannabis Board clarifies structure or function statements on products that are acceptable and are not acceptable. Of course, it is acceptable for a consultant to share information on a product label with a patient during the course of educating a patient on certain products. Here are a few examples of what acceptable structure and function claims might look like and what they might not look like. Helps maintain cardiovascular function and a healthy circulatory system would be okay. Relieves crushing chest pain or prevents a heart attack would not be okay. Promotes relaxation is acceptable. Prevents depression would not be acceptable. It's important to be aware of what should and shouldn't be on labels so that you can help patients know what to look for in selecting products. These rules are important to avoid false claims or promises to cure, reverse, or prevent a disease, but they can also present challenges for patients who have no idea what product to choose that may help their medical condition. That's where you as the consultant can make all the difference. Be familiar with your product. Be aware of DOH-compliant products and where to find them, even if it's at another location. Be ready to answer questions and do what you can to make sure that patients are armed with the information that they need to make informed decisions. Help them to understand the labeling so that patients can know the strain, ingredients, and cannabinoid or terpene content in a product. So next up, we will go over 3 common questions that consultants may hear from patients.
Where can I find organic product?
Well, this is a trick question. As we know, organic is a federal term coined by the USDA, so there is no organic product on the market. There are DOH-compliant products and many other products that have mirrored their testing and growing standards to the USDA, but you should know that the term organic can't technically be used for cannabis at this time.
Where can I find DOH-compliant products?
Any licensed retail store may sell DOH-compliant products, except for DOH-compliant high-THC products, which may only be sold by a medically endorsed retail store and may only be purchased by a qualifying patient or designated provider who is registered in the database. At this time, DOH-compliant products can be challenging to find in stores, so make sure to encourage patients to ask stores to stock DOH-compliant products and become familiar with stores that do sell compliant products.
When I go into a store, how do I know what product to select?
When you go into a store, ask to speak to a certified medical marijuana consultant who can help with product selection and what to look for in product labels. It may be a good idea to call the store in advance and schedule an appointment, or at least confirm a certified consultant will be on staff that day. The patient can also try having a conversation with their healthcare provider about what products may help with their particular medical condition. Next, we will go over the patient experience from start to finish and take a deeper dive into how an individual can qualify as a cannabis patient in the first place. To qualify as a cannabis patient, a person must be under the care of a healthcare professional and be diagnosed as having a terminal or debilitating medical condition. They must be a resident of the state of Washington at the time of such diagnosis, and the patient must have an authorization from their healthcare professional or get entered into the medical marijuana authorization database and has been provided a recognition card. These are the qualifying conditions to be considered for medical cannabis authorization: cancer, HIV, multiple sclerosis, epilepsy or other seizure disorders, spasticity disorders, intractable pain, which means pain unrelieved by standard medical treatments and medications, glaucoma, either acute or chronic, which means increased intraocular pressure unrelieved by standard treatments and medications, Crohn's disease with debilitating symptoms unrelieved by standard treatments or medications, hepatitis C with debilitating nausea or intractable pain unrelieved by standard treatments or medications, diseases including anorexia, which result in nausea, vomiting, wasting, appetite loss, cramping, seizures, muscle spasms, or spasticity when these symptoms are unrelieved by standard treatments or medications, chronic renal failure requiring hemodialysis, post-traumatic stress disorder, and traumatic brain injuries. Please note that there is no need to ask a patient their qualifying condition. This is for your awareness, to help gain an understanding of symptoms that people may be experiencing and asking for help to address. In 2019, the average age of adult patients was age 50. In 2021, the average age has moved up to 52. The average age of a minor patient in 2019 was 12 years old and is still 12 years old to this day. There are several evidence-based health benefits associated with medical cannabis use. They include chemotherapy-induced nausea, multiple sclerosis-related spasticity, symptoms related to some forms of epilepsy, and some forms of chronic pain. There will be links included at the end of this presentation that you will receive in an email if you would like to learn more. Of course, there is also evidence-based negative health effects that have been noted. Vulnerable populations in particular may be more susceptible to cannabis-related cognitive effects, cannabis use disorder, which is cannabis dependence. They may be at a higher risk of other substance use dependence. They may experience respiratory distress or possibly experience an increased heart rate. While these may not be part of your everyday conversations with patients, it is good to have this awareness in case you get questions such as what are some possible negative side effects of cannabis use, or if a patient comes back and reports that they noticed they had an increased heart rate and maybe they were concerned. If a patient ever expresses concern about how cannabis may be affecting their body or their medical conditions, you must always advise the patient to consult with their healthcare provider right away. It's important to remember that as a medical marijuana consultant, you may not diagnose, offer to treat, or recommend changing treatment outside of cannabis to a patient. Learning about some of the negative side effects that patients may experience can help you to be ready to point out to a patient that they may need to check with their healthcare provider. Cannabis addiction, known as cannabis use disorder, is a condition that impairs social functioning, memory, decision-making, and school or work performance. Symptoms may include difficulty controlling or cutting down use, needing more potent cannabis to get the same effect as before, experiencing problems or interference in social, work, or school life. For some, not using cannabis may cause irritability, sleep or appetite problems, nausea or abdominal pain, and some may continue to use despite experiencing physical or psychological problems. It is important to note increased risks associated with cannabis impairment and to share this information with patients who come into your store, particularly first-time patients. They may not realize the possible increased risks, especially when they're trying to figure out their personal ideal dosing, which is often a trial and error experience. It's important to share that driving while experiencing the effects of cannabis is unsafe. If someone must drive, there should be a very large buffer after any marijuana use, and if someone has eaten an edible, that time may need to be increased by several hours due to the possibility of delayed and prolonged effects. So next, we'll review some basic regulations around healthcare providers who may authorize cannabis for medical use. Only specific healthcare license types may authorize medical marijuana, and that list should be on your screen right now. Current regulations in Washington do not require that the practitioner register with the department or obtain additional certification before issuing an authorization. It is recommended that healthcare practitioners who authorize follow the professional practice standards developed by the regulating boards and commissions, which includes the authorizing practitioner take a continuing education training course on authorizing marijuana. Healthcare practitioners are not required to report or notify the department of this activity. This is kept confidential between patient and practitioner, as the decision to use marijuana is best made by the patient in collaboration with their healthcare provider. It is important to be aware that some patients have reported having a hard time finding a healthcare provider willing to give them a medical marijuana authorization. Healthcare practitioners are not required to issue authorizations, and there are several reasons why they may choose not to do so. A healthcare provider may not be familiar with medical uses for cannabis, and therefore may not feel comfortable incorporating it into their patient's treatment plan. The provider may work for a facility that is federally funded, and it may be a risk to authorize cannabis for medical use since it's not legal federally. In order to authorize medical cannabis, there needs to be an existing patient-provider relationship. This is not an in-and-out authorization process, and practices cannot solely exist around issuing authorizations. There should be other health services offered, and some kind of follow-up care is expected after issuing a patient an authorization. The authorization expires after a year or less for adult patients, or after 6 months or less for minor patients, depending on the healthcare provider's treatment plan. There should be follow-up appointments for authorization renewals and treatment plan updates at a minimum. Next, we will go over the designated provider, who they are, and what their role is. First, a designated provider is not a healthcare provider. They are defined under statute as someone who is 21 years of age or older, a parent or guardian of a qualifying patient if that patient is under the age of 18. They must have a separate signed authorization form from the qualifying patient's healthcare practitioner, which is provided at the time of the medical visit. The patient has to find their own designated provider. It's usually a family member or somebody involved in their care, but it's not going to be a healthcare provider, a nurse, or anything like that. And a designated provider can only be the provider to one patient at a time, which means that a designated provider cannot do it for, say, both of their kids. This can present challenges for families and parents with more than one minor child who is a qualifying patient. So what does a designated provider do? The designated provider, once entered into the database with the patient, can go into medically endorsed stores without the patient and purchase product on their behalf. Please note, the patient and the designated provider need to go to the store together to register for the first recognition card. After that, purchases and card renewals can be done by the designated provider. If the patient chooses not to register in the database, they can still have a designated provider, and the designated provider may still purchase product on their behalf, but within the legal recreational limits only. Designated providers may grow plants on behalf of the patient. Please be aware that patients under the age of 18 are required by law to have a designated provider, and they must enter into the medical marijuana authorization database along with the minor patient. The designated provider of a minor patient must be 21 years of age or older, the parent or legal guardian of the minor patient. They must be named on the minor patient's medical marijuana authorization form and have a separate, fully completed form also printed on tamper-resistant paper, and they must be entered into the medical marijuana authorization database and have a designated provider recognition card, which is separate to the patient card. Minor patients may accompany their designated provider into a medically endorsed retail store only for the purpose of purchasing the child's medication. Patients aged 18 to 20 years who have a valid photo ID and an authorization form may enter a medically endorsed store only for the purpose of being entered into the medical marijuana authorization database and getting their recognition card without having a designated provider. They do not have to have a designated provider. After they get a card, they may enter and make purchases at medically endorsed cannabis retail stores only. They cannot enter a non-medically endorsed store even if they have their recognition card to make purchases. I also wanted to touch briefly on cannabis use in youth and young adults. It is important to remember that the decision to use cannabis for medical purposes is between the patient or their parent or guardian and the healthcare provider. Youth and young adults who start using cannabis earlier in life, use cannabis more frequently, or use cannabis products with a higher THC concentration may be at an increased risk of cognitive effects, including learning and memory impairment and decreased educational attainment, cannabis use disorder, again cannabis dependence, poorer mental health, especially for those experiencing or who have increased risk of behavioral health disorders. This information is for your awareness only, as you will occasionally work with minor patients and their parents or guardians, and they may have questions or report concerning side effects after their minor child uses or used medical cannabis. Please remember that as a medical marijuana consultant, you cannot diagnose a medical condition, offer to treat, or suggest changing treatment for a patient. And if a patient or their parent, guardian, or designated provider has any concerns, they should contact their healthcare provider. You should always talk to patients about the importance of safe storage and ways to keep cannabis away from children and pets. Children, adults, and pets can mistake marijuana products, particularly edibles, for regular food or candy. Consuming marijuana can make children very sick. Accidental marijuana poisoning in children has increased, sometimes requiring visits to the emergency room or hospitalization. Always advise patients to store cannabis in child-proof containers and safely out of reach of children and pets. Symptoms of intoxication or poisoning in children can include lethargic behavior, uncoordinated movements and decreased psychomotor activity, such as slurred speech, increased heart rate progressing to slowed heart rate, low blood pressure, difficulty breathing, sedation, or coma. Please note that ingestion, edibles, leads to the majority of cases of cannabis poisoning or intoxication reports to the poison centers. I also wanted to touch on cannabis use in pregnant and breastfeeding individuals. The CDC states cannabis use during pregnancy can be harmful to infant health. Existing research has shown an association with low infant birth weight, an association with neurodevelopmental effects for child, particularly when exposed to cannabis smoke in utero, and that constituents from cannabis can be passed through breast milk. THC can be stored in fat and slowly released over time. Over the past decade and continuing presently, there has been notable increase in cannabis use during pregnancy. As always, if a patient has questions about cannabis use and their medical condition or pregnancy, refer the patient to their healthcare provider. Next, we will go over a few common patient questions that you may be asked as a consultant.
My doctor gave me this authorization. How does this work?
Again, remember that this is a new and sometimes uncomfortable world for a lot of people. Do what you can to help patients feel comfortable, smile, explain the process, listen to their questions. Tell them about the database and the benefits of registering so they can decide if they would like to have a recognition card or not. If they do register, when you hand them the card, explain what it means, when they may need to show it, and explain the expiration date and that they will need to get a new authorization form from their healthcare provider before that date and return to a medically endorsed cannabis retail store to get a new card. This would be a great time to have some of our informational pamphlets printed out and ready to hand to patients with their new or renew card so that they know that Department of Health is a resource as well.
Do you have any advice and or suggestion regarding dosing amount and frequency, side effects to watch out for, and any information regarding methods of administration? Example, with food, after dinner, when can I drive, and etc.
Of course, a consultant cannot diagnose a condition or prescribe any product. However, if you are asked about dosing, the best practice is to share that they should start low and go slow. Start with a small dose, see how it feels, and gently increase as needed until they experience the desired results. Always suggest a method other than smoking if possible. It is acceptable to explain to patients how to use the product. It is acceptable to explain how food can affect dosing. For example, trying an edible on an empty stomach may feel different to having an edible after a meal. It's important to remember that you're not a healthcare provider, but you are part of the patient's care team. If they have questions about their medical condition, how cannabis may interact with other medications or medical conditions, those should all be referred back to the patient's healthcare provider. Additionally, according to RCW 6951A-060, no person shall be entitled to claim the protection from arrest and prosecution under RCW 6951A-040 or the affirmative defense under RCW 6951A-043 for engaging in the medical use of marijuana in a way that endangers the health or well-being of any person through the use of a motorized vehicle on a street, road, or highway.
For my medical issue, what products would you recommend I try?
Always defer to what, if any, recommendations a healthcare provider has suggested for a patient's medical use. Remember that you cannot provide medical advice, diagnose any conditions, recommend changing current treatments in place of marijuana, or open and use actual products when demonstrating how to use. Avoid using any terms that suggest a product will cure, prevent, or treat a disease. An example of a way to appropriately provide helpful information about products would be to share that a product may promote relaxation versus saying this product may cure depression. However, you can assist the patient with selecting products that may help with their qualifying condition. You can describe risks and benefits of methods for using products. You can give advice on ways to properly store products and how to keep them safe from children and pets. You can show patients how to properly use products, and you may answer questions about the medical marijuana laws. A common concern from patients is that they don't want to feel high all the time, and they rely on your expertise to help guide them to strains and methods of ingestion that may help with relief from qualifying conditions without the high that recreational cannabis users may be looking for. Always remember that you are often the first contact into medical cannabis, and patients sometimes won't know where to start. Always listen to their needs and use that information to help guide your conversation with them as far as products that may help with their qualifying conditions. Become familiar with your products and know that this is really the time that patients are relying on your expertise and patience with them as they navigate through a new world that may seem intimidating at first. It's important to know that the time and effort that you put in with a cannabis patient could be life-changing to that person. Become familiar with growers and producers as you can, listen to what the patient is looking for, and help empower patients by being a resource and pointing them to other resources that can help them find or grow the best medicine for their needs and understand the law around medical use. Next, we will talk about the authorization form. The first thing to know is that the authorization form is not a prescription. An authorization form is a recommendation by the patient's healthcare practitioner to use cannabis for medical purposes. It allows a patient to register in the Medical Marijuana Authorization Database and receive a recognition card. It allows a patient to grow up to 4 plants without being entered into the state registry. But keep in mind, if a patient chooses to register, they can grow between 6 and 15 plants if authorized by their healthcare provider. It is a written designation for an individual to be a designated provider. This is important to know because when a patient comes in with an authorization form, you must know what to look for in order to ensure that it is complete, authentic, and accurate. The Pharmacy Commission approved tamper-resistant paper contains at least one industry-recognized security feature designed to prevent unauthorized copying, unauthorized modification, and use of counterfeit forms. It also contains the RCW 6951A-030 medical marijuana seal in the bottom right corner. When this paper is purchased by the healthcare provider, it is blank with the logo printed in the bottom corner. Remember, the authorization is not a prescription and it cannot have the mortar and pestle symbol or the RX logo typically found on prescriptions. The authorization form is divided into 3 sections: the patient and designated provider information, the healthcare practitioner information, and the healthcare practitioner recommendation and certification. If you take a closer look at the form, you will see the first question is the issue type, and that will tell you if you are registering a new patient in the database or if you are renewing an existing patient. Down the left side of the form, we have assigned line numbers as a reference point. For example, line item 1 is for the patient's full name and date of birth. Line item 2 is for the patient's street address, which is defined under law as the patient's residence where plants may be grown. Because of this, it must be a physical address, not a P.O. box. Line item 3 asks the practitioner a question: does the patient have a designated provider? If yes is selected, the patient must sign line item 6, unless that patient is a minor. The designated provider's name, date of birth, and physical address are entered into lines 4 and 5. If no is selected, the practitioner continues on to complete Section 2, Healthcare Practitioner Information. Section 2 contains information specific to the healthcare practitioner and clinic location. Current regulations under RCW 6951A-010 requires the practitioner to have an active credential to be allowed to issue a medical marijuana authorization. The third section, towards the bottom of the form, goes into a little more detail about the qualifying medical condition, compassionate care renewal authorization, and of course the signature line. On question 9, the provider will indicate which qualifying condition the patient has that may be benefited by the medical use of cannabis. Item 10 indicates if a patient is eligible for a compassionate care renewal. If yes is indicated, then a consultant would proceed accordingly, and we will go into more detail on this process later. Please note that if item 10 is marked yes, it does not mean that the patient must have a designated provider. They may or may not choose to take advantage of the option to use the compassionate care renewal. Item 11 includes a question for the practitioner explaining that yes, the patient may grow their own plants with the authorization, and to grow more would require the patient to register in the database. This is a yes or no option. If the healthcare practitioner indicates yes, they may also authorize between 6 and 15 plants to be grown in the patient's home. If they indicate no, then the standard 4 plants may be grown by the patient or designated provider if they are not registered in the database, or 6 plants may be grown if they are registered and have that authorization card. Item 12 has the provider fill in the issue date and the expiration date. Remember that an adult's authorization can be good for up to 1 year, and a minor patient's authorization is only good for up to 6 months. Finally, item 13 is for the practitioner's signature and the date signed. So let's talk about that compassionate care renewal box that we just saw on the authorization form in the previous slide. Effective July 28, 2019, House Bill 1094 established the Compassionate Care Renewal Act, and this primarily does 2 things. It allows an eligible patient to receive their medical authorization renewal through the use of telemedicine. Eligibility for this is determined by the patient's healthcare provider. Under current regulation, an in-person physical examination is required to renew a patient's authorization. If their healthcare practitioner determined that requiring an in-person physical examination to renew an authorization would likely result in severe hardship to the patient because of their physical or emotional condition, then the practitioner may indicate that the patient is eligible for a compassionate care renewal through the use of telemedicine. Additionally, a compassionate care renewal eligible patient is exempt from having to be physically present at the retail store to obtain a new photo to renew their database registration and card, instead allowing the qualifying patient's designated provider to renew on their behalf. So what if a patient asks, what is a compassionate care renewal, and how do I know if I'm eligible for it? After the first initial in-person physical examination and visit with a healthcare practitioner to obtain a medical marijuana authorization, the healthcare practitioner may indicate that you are eligible for a compassionate care renewal if an in-person visit would cause you severe hardship. A compassionate care renewal allows a patient's medical marijuana authorization to be renewed through the use of telemedicine. If a patient is concerned about in-person visits to renew their authorization causing a hardship, let them know to contact their healthcare provider to see if they may be eligible for compassionate care renewals. Please note that if a patient is eligible for a compassionate care renewal and they were previously registered in the state database, the designated provider may renew their database registration and card for the patient without the patient physically present at the store. Also note that question 10 on the medical marijuana authorization form indicates whether or not a patient is eligible for a compassionate care renewal of their registration in the database. Certified consultants should be aware that even if question 10 is marked yes, it is optional for a patient to choose to take advantage of this allowance. If the patient is there in the store and they have a valid form and want to be registered, please register the patient. You do not have to make them return to their practitioner for a new authorization. A qualifying patient who is compassionate care renewal eligible will need to have a designated provider to take advantage of the options allowed through CCR and will need to be issued 2 medical marijuana authorization forms, one for the qualifying patient and one for the patient's designated provider. A designated provider who brings in the appropriate authorization form may be registered in the database and issued 2 recognition cards, one for the patient and one for the designated provider. So say a patient says to you, if I don't register in the medical marijuana authorization database, why should I bother getting a medical marijuana authorization form from my healthcare provider? Well, this is a great opportunity to let the patient know that an adult patient who has a valid medical marijuana authorization form but is not registered in the database and does not hold a recognition card may still grow up to 4 plants and possess up to 6 ounces of usable marijuana for personal medical use within his or her home. Remember, at this time, recreational home grows are not legal. However, that patient would not receive the benefits of being an adult patient with a recognition card. When purchasing products, they would be treated like any adult age 21 or older. And finally, they may raise the affirmative defense if they meet certain criteria, which is outlined in RCW 6951A-043. So next, we will go over a few questions that you as a consultant might have as you navigate the database. First, does the issue date and the sign date have to be the same on the authorization form? The answer is no. When entering a patient, please use the issue date to create the record. Next, what if the designated provider's name on the form does not match their state-issued identification? If the designated provider is renewing a patient's registration, their name must match their state-issued identification. Please ask them to work with the patient and their healthcare provider to get a corrected form. And finally, what if a designated provider comes in to renew their registration for a patient, but when I search for the patient, the system does not return any results? Remember that the Compassionate Care Renewal Act is specific to renewals only. If the patient was not previously registered in the database, they will be required to come in person the first time to have their identity verified and their photo taken. So checking back in with the agenda, our final section will be on the Medical Marijuana Authorization Database. But before we get started, we wanted to review some common concerns and do a little myth busting. It's important to talk about what happens to a patient's information when they enter the database. Registering in a state database when cannabis is still illegal federally can understandably make some folks nervous. One thing you can do to help is to share accurate information with the public so that they can make the best choice for themselves. So, can federal authorities see that I'm in the database? No. Information contained in the Medical Marijuana Authorization Database shall not be shared with the federal government or its agents unless the particular qualifying patient or designated provider is convicted in state court for violating the law. You can see more information in Chapter 6951A-230 RCW. If I join the database, will I lose my social services, such as housing and food assistance? The answer is no. There is no way for either federal or state social service agencies to search the medical marijuana database to see if someone is a patient. The only way they may find out is if you reported this to them, that you are a patient in the database. So to review, there are several benefits to registering in the Medical Marijuana Authorization Database. As a consultant, it is important that you are aware of the benefits of registering so that you can share accurate information to patients so they have everything they need to make the best choices for themselves. These benefits include that they may purchase products at the medically endorsed retail store, sales and use tax-free. They may purchase up to 3 times the current limits at licensed retail stores with a medical marijuana endorsement. They may purchase high-THC, DOH-compliant products when available. They may possess 6 plants and 8 ounces of usable marijuana. A healthcare practitioner may authorize additional plants up to a maximum of 15. A patient so authorized may possess up to 16 ounces of usable marijuana produced from their plants. Registered patients may participate in a medical marijuana cooperative. They are eligible for arrest protection, and they may purchase immature plants, clones, and seeds from a state licensed producer. To review, there are 2 options for those looking to become cannabis patients. They can get an authorization form from their healthcare provider, be done at that point, and receive the benefits listed, or they can get an authorization form from their healthcare provider and then take the next voluntary step of registering in the database and be eligible for the benefits on the left of the slide as a registered cardholder. Please remember that minor patients and their designated providers must register in the database. If you have a valid authorization form, but are not registered in the database, aka you are not a card holder, you may possess no more than 4 plants, you may only purchase or possess recreational limits, and instead of arrest protection, you have an affirmative defense. The benefits to registering and holding a recognition card include that you may purchase 3 times the recreational limits, you may possess 6 to 15 plants if you are authorized by your healthcare provider, you may purchase high-THC products when available, you may make purchases at endorsed retail stores that are not subject to sales and use tax, you are eligible for arrest protection, you may participate in a cooperative, and you may purchase immature plants, clones, and seeds from a licensed producer. If a patient is authorized by their healthcare provider but choose to not register in the database, that patient may purchase the same lower amounts as recreational customers. The patient may grow and possess 4 plants, and they will have an affirmative defense to criminal prosecution if they possess no more than 4 plants and 6 ounces of usable marijuana from their plants. Just to reiterate, this is not arrest protection. So what does it mean to have arrest protection with that recognition card? According to RCW 6951A-040, the qualifying patient or designated provider may not be arrested if he or she has been entered into the medical marijuana authorization database and holds a valid recognition card and possesses no more than the amount of marijuana concentrates, usable marijuana, plants, or marijuana-infused products authorized under RCW 6951A-210. So then what does it mean to have an affirmative defense? Qualifying patients or designated providers who are not entered into the medical marijuana authorization database and do not hold a recognition card, but who present their medical marijuana authorization form to any law enforcement officer who questions the patient or provider regarding their medical use of marijuana, may assert an affirmative defense to charges of violations of state law relating to marijuana through proof at trial by a preponderance of the evidence that they otherwise meet the requirements of RCW 6951A-040. A qualifying patient or designated provider meeting the conditions of this subsection, but possessing more marijuana than the limits set forth in RCW, may, in the investigating law enforcement officer's discretion, be taken into custody and booked into jail in connection with the investigation of the incident. It is understandable for patients to feel hesitant to register in a state database when cannabis is still illegal on a federal level. That is why it's very important that you, as the consultant, be knowledgeable about who can access the information in the database and for what purpose. Make sure that patients know that they are not automatically entered into the database. To be entered into the database, a patient must take their authorization form and photo ID to a licensed and medically endorsed retail marijuana store. A certified consultant will then enter their information into the database and create the medical marijuana recognition card. The medical marijuana authorization database is a secure system. State law strictly limits who can view database information and how that information can be used. Only certain people can see information from the database for the following purposes. So to access their patient's healthcare information from the database, authorizing healthcare providers, and practitioners authorized to prescribe or dispense controlled substances. To add patient information from the authorization form into the database, certified medical marijuana consultants working in a medically endorsed marijuana store. To provide administration or get reports, there are the database administrators for data maintenance and store support. There's the Washington State Department of Health to ensure compliance. We have the Washington State Department of Revenue for sales tax-free reports, and the Washington State Liquor and Cannabis Board for aggregate data reports. Finally, to verify that a card is valid, we have law enforcement and employees working in a medically endorsed marijuana store. I also want to connect with everyone and just share a little information about the security features of the database. Senate Bill 5052 required that the medical marijuana authorization database be contracted with an entity to create, administer, and maintain a secure and confidential data system rather than be hosted by the Department of Health. This measure was to safeguard its contents from either required or unintentional disclosure. Records in the database containing names and other personally identifiable information of qualifying patients and designated providers are exempt from public disclosure requests, inspection, or copying. RCW 6951A230 states any personally identifiable information included in the database must not be susceptible to linkage by use of data external to the database, so no other systems or programs can link into or access this database. That same RCW states that information contained in the medical marijuana authorization database shall not be shared with the federal government or its agents unless the particular qualifying patient or designated provider is convicted in state court for violating this chapter or Chapter 6950 RCW. So this graph is just a visual on how many recognition cards have been created each year since the implementation of the system. Please note that numbers account for each initial, renewal, and replacement card created for both patients and designated providers, and it is not specific to the unique number of individual patients registered in the medical marijuana authorization database. As we can see, cards created have been on a slight decline. This may be due in part to the economic impacts of COVID-19. 2021 was on track to at least match or slightly exceed cards created in 2020, so we may be seeing a slight change in the future to this trend. In this next section, I will review the technical process around the workflows in the database. So step 1, the process starts with an authorization form validation. Authorization form validation is done when the consultant reviews the form to ensure that it meets all the requirements. That means that the form is complete, either handwritten or typed is fine, signed by the healthcare practitioner, original signatures only, no stamp signatures. It must be printed on tamper-resistant paper with the RCW logo on the bottom right corner, and the patient must sign item line 7 in section 1 if they have a designated provider and are over the age of 18. Please note that minor patients do not need to sign that line as they are required to have a designated provider. If the form does not meet all of these requirements, the person may not be entered into the database. Please advise the patient to contact their healthcare provider to make any necessary corrections and then return to a medically endorsed cannabis retailer to be registered in the database. Step 2. During the review of the authorization form, identity verification will also take place, which is step 2. The medical marijuana consultant must verify that each adult patient or designated provider matches their photo identification. Again, minor patients and compassionate care renewal patients are verified through the designated provider, so there is no need to verify a minor's identification or a patient whose designated provider is doing their renewal on the patient's behalf. In the event of an inexact match of names between the identification and the authorization, the consultant should take necessary steps to ensure that the patient or designated provider they are working with is the same person presenting the form. This may include calling to confirm the patient's status with their healthcare practitioner or verifying against a different piece of identification if they have one. Step 3. Now that you have verified the authorization form is valid and filled out properly, and you have verified the patient and designated provider's photo identification, the next step is to take the photo that will go into the database and be shown on the recognition card. The photo needs to be taken against a white backdrop, but if the patient is bald or has white hair and this is causing an issue, a beige or a light blue background can be used as well. Make sure the person is standing straight and there is no head tilt or angle, and make sure there is plenty of lighting to get a clear, consistent photo every time. Aim to get a photo of the person's upper shoulders and head with a little space above for the background. Unless the patient is eligible for a compassionate care renewal, a new photo is taken every time a new patient is registered in the database and every time a patient renews their recognition card as well. Step 4. Now you will search for the patient and enter them into the database. Search for the patient by name and date of birth as listed on the authorization form. You may also search by card number if you are doing a renewal. If the patient is found in the system, a form will appear with the patient and designated provider information if they have one. If that happens, you cannot create a duplicate card. You must edit and update the current card to process the renewal. Step 5. If you are processing a renewal, you will want to select Yes when prompted. Then the system will ask you, is this a compassionate care renewal? Check the authorization form and choose Yes if that is indicated on the form on item 13. Choose No if it is indicated No on the form. Then you will click Renew the card. For a standard renewal, only the single card will appear on your screen for review. Compassionate care renewals will show both cards, one for the patient and one for the designated provider at the same time on your screen. If the patient is not found in the system, proceed with the new card creation process by clicking the Create New Authorization button. Next, you will enter the correct information from the authorization form into the database to create the new card. For the patient card, you will want to confirm that a valid healthcare practitioner license is entered in from the authorization form. The information for the healthcare practitioner must match the data in the database. If the healthcare practitioner cannot be found in the database, a card cannot be created. Then, for the designated provider, if there is one, you will have to search for the patient as listed on the authorization form. You will select Patient Authorized to Assist. If the patient is not found in the system, a card cannot be created for a designated provider. You will want to verify the patient is already registered in the system, which must be done before a designated provider account can be created. Once you select the patient, they will be added to the designated provider's account, and you can complete the registration using the information on the designated provider's authorization form. So this process is a little different for a minor patient. After you complete the authorization form for the minor, the system will prompt you to enter the information for the designated provider automatically, since a minor must have a designated provider. Step 6. Review, edit, and generate the cards. For a standard renewal or an initial card, you will want to select Complete and save the record. This will pull up a screen that lets you see a preview of the card you are about to create. Here, review the card for accuracy, edit if needed by hitting the Edit Authorization button, and make the necessary changes. Or, if everything is accurate, go ahead and generate the card. For a compassionate care renewal, the screen will show you both cards. Review both cards for accuracy, for the patient and the designated provider, edit anything if needed, or generate the cards using the same process for standard renewals. Step 7. Print, cut, fold, and laminate the cards. Make sure that your printer is connected to your computer and fully functioning. Select Print to print one copy on plain white paper. The database will utilize your browser's print menu. Cut along the dotted lines and fold where marked. Next, you will need to laminate the card. Hand the card to the patient or the patient's designated provider if they have one. So to wrap up this section, here are some important database and user reminders. A patient must be pre-registered in the database to be eligible for a compassionate care renewal of their database registration and recognition card. It is always a good idea to use Google Chrome as the preferred internet browser. You will always log into the database through your SAW account. Keep your user profile active by logging in at least once every 30 days. This will help minimize the SAW authentication challenges, and it helps you become familiar with the system. It will keep your account active. And finally, protect yourself. Never share your username or passwords with anybody. So, just to recap, what is the process for entering a compassionate care renewal patient into the database? The process for registering a compassionate care renewal eligible patient is defined under WAC 246-71-040, which requires a certified consultant to verify the designated provider's identity, confirm valid authorization, enter their information into the database, and take a photo of the designated provider. And once registration is complete, do you issue both cards to the designated provider? And the answer to that is yes. You will issue both cards to the designated provider, instructing them to make sure they give the patient their card to keep in a safe place. Are consultants allowed to retain photos of the patient or retain medical authorizations or recognition cards to help with validation of compassionate care renewal patients? The answer to this is no. The new workflow in the database will allow you to reuse the patient photo to complete a compassionate care renewal, so there is no need to save photos for the purpose of processing compassionate care renewals. A designated provider does not need to have the patient's recognition card on hand when they come into the store to purchase products on behalf of the patient. They only need to provide their own recognition card. And the reason we don't have stores retain photos or authorization forms is to protect patient privacy. Authorization forms should not be copied, and the original should be returned to the patient or the designated provider after they have been registered. So, after all this information and time spent together, how do we keep in touch moving forward? The cannabis industry is changing constantly. It is important that we are able to reach you when there are program updates and special notices that you should be aware of in your work as a medical marijuana consultant. The program also sends out quarterly updates with hot topics, frequently asked questions, rulemaking updates, and we like to feature new or updated publications when we can. If you are not receiving these notices and updates, please contact us and make sure that your email address is on the program's distribution list. These newsletters are a way for us to stay connected and provide important and hopefully helpful information to you. If there is something you want to see featured in a newsletter, just let us know. If we do not address your question today, please don't worry. We will be following up with this training with an email that will include a link for you to submit any questions you may have. This email will also include resources from this training and a link to complete the quiz so that you can receive your certificate of completion to count for 2 hours of continuing education credit. You must pass the quiz with a score of 70% to be eligible for the certificate of completion, and please be aware that completing this training and passing and submitting the quiz is a requirement to maintain your medical marijuana certificate every year. Thank you for taking this training. As always, the Medical Marijuana Program team is here to help and support you in the important work that you do for the medical community. We can be reached at 360-236-4819 or email us at medicalmarijuana@doh.wa.gov and check out our website for all kinds of information at doh.wa.gov/medical marijuana. Thank you.